tummy tucks and drains. Do we need them? Do we not need them? What's the deal? Why do some people use them and others don't? So I made this video to apply for everybody, but always check with your specific surgeon, because as you're going to see, everyone has their own opinions about when to use a drain or not use a drain. On this, we actually made this specifically for a tummy tuck, but I can tell you this applies a lot to arm lifts, thigh lifts, really anything where we lift a big skin flap up and we were worried about what we call potential space. And so let's go through that really quick. What is a potential space? Potential space just means that we have taken an area, we've lifted a flap up. So like if this was a piece of skin that we lifted up, skin and fat, and this was muscle down here, this is skin and fat, we dissected it up, and then we're actually going to sew it back down. But because we've lifted it up, we have this area that is no longer really attached. Your body has to heal it back together. And so we call that a potential space, because the idea is it possible that water or fluid could move in that space? Remember, you're about 60 to 70% water. Is it possible that could actually fill that up and then you would get fluid in that area? And the answer is yes. We call it a potential space. And that's one of the risks anytime that we lift up tummy tuck flaps, arm lift flaps, thigh lift flaps. That potential space filling up with fluid goes by the name of a seroma. And so you would imagine if we left a drain in here, we could then, if fluid filled up, we could suck that fluid out until the body starts to heal this area, no longer allowing fluid to come back in. And that's one of the reasons that we like drains, or the people that do use drains like them. Now, some people came along and thought, well, what if I just, when we're doing the surgery, during the tummy tuck surgery, if I just put stitches here to actually hold the skin flap down the muscle, and will that then get rid of that potential space? And studies honestly have been plus and minus. Some studies have said yes, some studies have said no. We do use these stitches because we think it helps to actually contour the skin flaps to give a nice little midline and relieve tension. These are called tension sutures, which makes sense because they hold the skin flap. If I do these, why do I still do a drain? Well, because in my hands, when I use a drain in my tummy tucks or my arm, I notice with the tummy tuck, I have less swelling and I have less risk of seroma, or that potential space filling up. And overall, when I look at my tummy tucks from months to years out, the people that I put drains in had a better result. And why is that? I don't know, because sometimes we take drains out right away. Most drains are going to come out 5 to 10 days if it's tummy tuck. If it's like arm lift, thigh lift, it could be 1 day as soon as getting the drains out. But overall, my results look better long term, and that's why I continue to use them. Some surgeons don't. Some surgeons say, actually, my results look the same when I don't use drains. So always check with them. But when we say to drain or not to drain, for us, it's a result-driven reason why we use the drains.